The pursuit of health, of well-being, is a primal instinct hardwired into every living creature. Throughout human history, this instinct has driven us to explore, to experiment, and to innovate. Often, in the absence of understanding, our ancestors resorted to practices that, to the modern eye, seem bizarre, even barbaric. Yet these practices were born of an earnest desire to alleviate suffering and prolong life. Join me now as we embark on a journey through the annals of medical history. We venture into the dimly lit corners of ancient libraries, where dusty texts whisper tales of long-forgotten remedies. We'll examine the crude instruments that once held the weight of life and death in their cold, metallic grasp. Our journey will be, at times, unsettling, but it is a journey worth taking. For in understanding the missteps of the past, we gain a deeper appreciation for the remarkable strides we've made in the relentless pursuit of health. Here in this hushed sanctuary of knowledge, the echoes of bygone eras linger. Bound within these ancient tomes are the collected wisdom, the hopes, and the desperation of generations past. See, the spidery script, penned by flickering candlelight, details treatments that range from the seemingly logical to the truly bewildering. These brittle pages speak of herbal concoctions, of poultices and potions, of rituals designed to banish illness. They tell of a time when the human body was as much a mystery as the cosmos above. And here, laid out with reverence, are the instruments that once bridged the chasm between theory and practice. These blades, these saws, these bone levers, they speak of a time when surgery was as much about carpentry as it was about healing. This delicate lancet, for instance, was used for bloodletting, a practice once believed to restore balance to the body's humours. Crude by today's standards, these instruments were nevertheless the cutting edge of their time. Each nick on their surface, each stain that time has not erased, whispers a story of pain, of resilience, and of the enduring human spirit in the face of unimaginable suffering. For over 2 millennia, the practice of bloodletting held sway in medical practice. From ancient Mesopotamia to the elegant salons of 19th century Europe, the sight of blood flowing into porcelain bowls was a common one. The theory behind bloodletting was rooted in the ancient Greek notion of the 4 humours: blood, phlegm, yellow bile, and black bile. An imbalance in these humours, it was believed, was the root of all illness. And what better way to restore balance than by draining away the excess? Here we see a physician employing this technique. The patient, weakened by their ailment, endures the procedure with stoic resignation. Whether they believed in its efficacy or simply placed their trust in the physician's hands, we can only speculate. But while bloodletting might seem barbaric today, it's important to remember the context in which it flourished. Without our understanding of germs, of bacteria and viruses, illness remained a mysterious, often terrifying force. And so, for centuries, blood flowed freely in the name of healing, a testament to the enduring human desire to find a cure, even in the most unlikely of places. The human skull, a fortress of bone protecting the delicate organ that houses our thoughts, our memories, our very essence. And yet, throughout history, this seemingly impenetrable barrier has been breached, not by violence, but by an earnest desire to heal. We call it trepanation, the practice of drilling or scraping a hole in the skull. Evidence suggests this procedure dates back thousands of years, with skulls bearing the telltale signs of trepanation unearthed from every corner of the globe. Look closely at this skull. See the smooth, rounded edges of the hole, indicating healing and, remarkably, survival. While some trepanations were likely performed to treat head injuries, others were driven by a belief in spiritual healing. Mental illness, epilepsy, even headaches. All were attributed to malevolent spirits trapped within the skull. By creating an opening, it was believed these spirits could be released, restoring the sufferer to health. The instruments used were rudimentary. Sharp stones, crude drills, even pieces of obsidian. Imagine the pain, the sheer terror that a patient must have endured during this procedure, often performed without the benefit of anesthesia. In the annals of medical history, few creatures have enjoyed such a long and storied career as the leech. These slimy, blood-sucking worms, often viewed with disgust today, were once hailed as miracle workers, their ability to draw blood seen as a path to restoring balance and health. The use of leeches in medicine, like bloodletting, was predicated on the theory of humours. By attaching leeches to specific points on the body, physicians aimed to draw out bad blood, thereby alleviating a range of ailments from headaches to gout to melancholy. Witness the scene in a Victorian-era doctor's office. Leeches, carefully stored in moist jars, are brought forth and applied to the patient's skin. There might be a slight prick as the leech's tiny teeth latch on, but soon a familiar feeling, the pull as blood is drawn out. While the sight of leeches might induce a shudder in many, it's important to acknowledge that in some cases this practice had merit. Leeches release a natural anticoagulant in their saliva which prevents blood clotting. Even today, leeches find a place in modern medicine, used in reconstructive surgery and to promote blood flow to reattached limbs. So, while the heyday of leech therapy might be behind us, these fascinating creatures continue to play a role in the ongoing quest for healing. Mercury, a shimmering quicksilver metal, fluid at room temperature, captivating in its beauty. But behind its allure lurks a dangerous toxicity, a fact that for centuries remained tragically unknown. In the realm of alchemy and early medicine, mercury held a position of power. It was believed to possess potent healing properties, capable of curing everything from syphilis to constipation. It was ingested, rubbed onto the skin, even used in the dangerous practice of mercury inhalation. Step into the alchemist's workshop. Amidst bubbling concoctions and the pungent aroma of herbs, we see mercury being carefully measured and mixed into various preparations. One popular remedy involved combining mercury with chalk to create blue mass pills, prescribed for a wide range of ailments. Little did they know these pills were slowly poisoning their patients, leading to a host of debilitating symptoms. The tragic irony is that mercury's toxicity, while poorly understood, manifested in ways that were often mistaken for its effectiveness. Tremors, excessive salivation and memory loss, all side effects of mercury poisoning, were seen by some as signs that the treatment was working, driving the body to expel the illness. In the heart of ancient Egypt, amidst the towering pyramids and elaborate tombs, a peculiar belief took hold. It was believed that the mummified remains of the pharaohs and nobles held a potent life force, an essence that could be harnessed for healing, and so began the practice of consuming mummy powder. Mummies, often stolen from their resting places, were ground into a fine dust, believed to cure a vast array of ailments. Headaches, ulcers, even the plague mummy powder was touted as a cure-all. Imagine the scene in an apothecary shop, shelves stacked high with jars containing exotic ingredients, and amongst them, a jar simply labelled mummy powder. Customers, seeking relief, would readily purchase this macabre remedy, unaware of its true origins. The practice of consuming mummy powder reached its peak in Europe during the Renaissance, fueled by a fascination with all things ancient. It became a status symbol, a sign of wealth and sophistication to consume the remains of those who had walked the earth centuries earlier. Of course, mummy powder held no true medicinal value. In fact, the conditions in which mummies were often stored, combined with the process of grinding them into powder, made them breeding grounds for bacteria and fungi. The human mouth, a gateway to nourishment and communication, is also home to a constant source of pain and discomfort, our teeth. And for millennia, the only recourse for a severely decayed or obsessed tooth was extraction, a procedure often carried out without the benefit of anesthesia. Imagine, if you will, the scene in a pre-anesthesia era dental office. The patient, perhaps already weakened by pain and infection, is seated in a chair that more closely resembles an instrument of torture. There are no sterile masks or gloves, no soothing music to distract from the impending ordeal. The barber surgeon, for that was often the title bestowed upon those who performed dental work, approaches with an array of terrifying tools, forceps designed to grip and wrench, chisels to break apart stubborn roots, all displayed with chilling nonchalance. The patient grips the arms of the chair, knuckles white with tension as the barber surgeon goes to work. There is the sickening crunch of bone, the metallic tang of blood filling the mouth, and the raw, unmuffled screams of the patient echoing through the room. It was a brutal, agonizing experience, one that left many permanently scarred, both physically and emotionally. And yet, people endured, driven by the desperate need to alleviate their pain, their only solace the hope that they would soon be freed from the torment of a throbbing tooth. In the quest for healing, humans have, at times, turned to the most unlikely of sources. And perhaps no source is more surprising, more jarring to our modern sensibilities than the use of human urine in medicine. Yes, you heard that correctly. For centuries, urine, that waste product we so readily flush away, was considered a potent elixir, a golden fountain of youth capable of treating a wide range of ailments. It was drunk, applied topically, even used to whiten teeth. Picture, if you will, a scene from the Renaissance. A respected physician, adorned in fine robes, stands before his patient, a small vial of golden liquid in his hand. The patient, perhaps with a grimace, accepts the vial, knowing that this unusual elixir holds the promise of a cure. The rationale behind urine therapy was rooted in the belief that urine, far from being a waste product, contained vital nutrients and healing properties. And while it might be tempting to dismiss this as utter nonsense, there is a grain of truth to it. Urine, in its sterile form, does contain small amounts of vitamins and antibodies. However, the risks associated with ingesting unsterilized urine, particularly in the days before proper sanitation, far outweigh any potential benefits. The 20th century, an era of unprecedented advancements in medicine, also witnessed the rise and fall of one of the most controversial procedures in medical history, the lobotomy. Developed as a treatment for severe mental illness, the lobotomy, in its crude simplicity, aimed to sever the connections in the brain that were believed to be the root of mental anguish. Imagine, if you can, the stark reality of a mid-century psychiatric hospital. The air is heavy with despair, the cries of the afflicted echoing through sterile corridors. In this setting, the lobotomy, despite its barbaric nature, was seen by some as a beacon of hope, a last resort for patients deemed incurable by other means. The instruments themselves send chills down the spine, ice pick-like tools, designed to be inserted through the eye socket to reach and scramble the delicate tissues of the prefrontal cortex. The procedure was often performed without anesthesia. The patient screams, muffled by the cold clinical walls. While some patients did experience a decrease in their symptoms, many more were left permanently damaged, their personalities altered, their spark of individuality extinguished. The lobotomy, once hailed as a miracle cure, became a symbol of medical hubris, a stark reminder that even in the pursuit of healing, we must tread cautiously, lest we inflict harm in the name of good. Our journey through the history of medicine has been, at times, unsettling, a stark reminder of the fallibility of human understanding. We've witnessed practices that elicit horror and disbelief, procedures that seem more akin to torture than to healing. And yet, amidst the darkness, there's a glimmer of hope that has illuminated our path. For every misstep, every misguided theory, every life tragically lost, there was a relentless drive to alleviate suffering, to unravel the mysteries of the human body, and to conquer disease. Emerging from the shadows of the past, we find ourselves in a new era of healing. Gone are the crude instruments, the dubious remedies, the desperate grasp at straws in the face of the unknown. In their place, we find gleaming hospitals, sophisticated diagnostic tools, and a growing arsenal of treatments that target disease at its very core. Our understanding of the human body, while still incomplete, has expanded exponentially. We peer into the microscopic world of cells and genes, unraveling the secrets of disease at their most fundamental level. We wield the power of antibiotics, vaccines, and gene therapies, offering hope where once there was none. But perhaps the most important lesson we can take from our journey through medical history is the importance of humility. For as we stand on the cusp of new medical frontiers, it's essential to remember that our knowledge, however vast, is but a drop in the ocean of what remains to be discovered. As we conclude our exploration of bizarre medical practices from history, we are reminded that the pursuit of health is an ongoing journey, a testament to human resilience and ingenuity. From the ancient practices of bloodletting and trepanation to the controversial lobotomies of the 20th century, the path to modern medicine has been paved with both innovation and miscalculation. These practices, while often misguided, reflect the deep yearning within us to alleviate suffering and prolong life. They serve as a stark reminder of the importance of critical thinking, scientific rigor, and a compassionate approach to healing. The quest for health is a journey that continues to unfold. As we delve deeper into the mysteries of the human body, we can only marvel at the progress made and approach the future of medicine with both optimism and a healthy dose of humility.